A Cumbrian pharmacist says that government cuts are putting businesses like his at risk. The Department of Health plans to reduce funding to community pharmacies by £170 million next year.
The government says efficiency savings can be made without compromising the quality of the service. But as Katie Hunter has been finding out, not everybody agrees.
Picking up a prescription and stopping for a quick chat. When Marilyn Talbot pops into her local pharmacy, the social benefits are almost as important as the medical benefits. Marilyn uses Alison's in Cockermouth twice a week and says she'd struggle without it.
It's not an exaggeration, I would be devastated, and I think so would a lot of people, because this Alison's means a lot to so many people.
More than 600 people in Cockermouth have signed a petition for pharmacies like this one. The Department of Health plans to reduce funding by 6% next year. The pharmacist here says that means £15,000 less for this business, putting it at risk.
At the moment we've got waiting times for GPs, long waits in A&E, but you can actually see a pharmacist here and now. You can walk in and see a pharmacist. You're going to end up with less pharmacies with the same number of ill people. So basically waiting times for pharmacies will go up. So I don't actually know what they're trying to achieve.
The government says community pharmacies are a vital part of the NHS. The Department for Health is currently consulting on how to make the system more integrated and efficient. The government insists that efficiencies can be made within community pharmacies without compromising the quality of service. But staff here aren't convinced. They say cuts will affect their business and their patients. Katie Hunter, ITV News, Cockermouth.
Well, we're joined now from our London studio by Rob Darracott, who's the Chief Executive of Pharmacy Voice, an organisation which represents the three biggest community pharmacy associations. Mr Darracott, we've seen there the fears from one local community about their local pharmacy. How could this affect patients who rely on these pharmacies?
Good evening, Rachel. I mean, as your piece has demonstrated there, community pharmacies are not just about the services they provide. They're a vital resource in the neighbourhoods up and down this country. And the proposals we have from the government so far are short on detail. They're very direct. They are talking about withdrawing 6% of funding this year. And at the moment, we're still not entirely sure exactly where that's going to be coming from. And what we're concerned about is the impact on those very patients that you've been highlighting.
Well, as we heard there as well, the Department of Health says that these cuts can be made without compromising quality. Do you believe that? Do you think that's possible?
I think we're still struggling to understand exactly where the department thinks the particular efficiencies that they're talking about are going to come from. There's a lot of material in the paperwork we've seen so far which talks about efficiencies coming through the use of greater use of technology, for instance, but the technology they're talking about is only now being tested and isn't in widespread use. I think if we'd had a more interesting approach would have been to work with us, I think, to work on some of the efficiencies that we think we could drive out of the system, and we may have been having a slightly different conversation. This is low on detail, high impact, and at the moment we're still struggling to see exactly what the impact is, and our members are rightly concerned.
And very quickly, are your members and yourselves trying to reverse these decisions at all?
We're involved in, as others are, in discussions with the government right now. We've put in some proposals for how we think some of these things should work, and we're interested to see the further detail of their proposals. But at the moment, that's what we're doing. We're trying to, we're interested in ways of exploring how pharmacists can support better public health, can continue to keep people safe by dispensing their medicines, can improve and support the use of medicines by people, and vitally, I think, keep the pressure off our hard-pressed general practitioners who are struggling too.
Thank you very much, Mr Darracott, for joining us this evening.
Thank you.
A man has been charged after 3 knife-point robberies were carried out in Carlisle. The incidents took place within an hour of each other last Saturday evening at Peking Chef on Petrol Bank Road, Bargain Booze on Central Avenue and Pizza Hut on London Road. 32-year-old Martin Bainbridge of Port Road has been charged with 2 counts of attempted robbery and 1 count of robbery.